My name is Dr. Andrea, a medical officer in Penang General Hospital. I've been very fortunate to have been given this opportunity to give a webinar on preventative screening in women. So, May is an exciting month filled with health awarenesses for women's health, from stroke awareness to lupus to arthritis awareness to osteoporosis. National Women's Checkup Day also happens to be in the month of May. World No Tobacco Day, as well as the day we are all most aware of, Mother's Day. So to commemorate this special month, I'll be giving a talk on preventative diseases in women. And this webinar aims to focus on what we can do to prevent diseases in women. And at the end of this webinar, my goal is to provide you with a clearer picture of the steps we can take to prevent certain diseases and the basic resources to feel on top of things. So we're going to talk about common preventable diseases and what actions we should take early on and the screening tests available for you. So women often spend so much time helping others, so much that they do not take the time for themselves. Does this sound like you? Well, I'm here to tell you that it is okay to use the time to focus on good health. And women face a range of health problems from breast cancer to cervical cancer, osteoporosis, pelvic inflammatory disease, and thyroid disorders, even heart diseases, and of course, fertility problems as well. So awareness for women's health is vital to improve the quality of life and wellness in women. And because women's health is such a broad topic, I will only be focusing on the common preventable diseases that women face. So I'll be focusing on these diseases: breast cancer, cervical cancer, and heart disease, in terms of what you can do to prevent them. So without further ado, let me just start with breast cancer. So in order to know more about preventing breast cancer, let's just talk a bit about what we know about breast cancer. So these are just some of the facts. So breast cancer happens to be the most commonly diagnosed cancer in women. And it is the most common cancer across all ethnic groups in Malaysia and in all age groups from females 15 years and above. So and also females have a higher risk to develop breast cancer than their male counterparts. And studies have shown that for males, there is a 1.15 per 100,000 man years, whereas in females, there's a 42.6 per 100,000 woman years. So it is important for us to notice the effect it has on women. So I mentioned that it is the most commonly diagnosed. Now, just how common is it? In Malaysia, 1 in 30 of all females have breast cancer. Very broadly, this means that out of a room of 30 females, at least one female is diagnosed with breast cancer. And when we separate females into races, we can see that Chinese women has the highest incidence of 1 in 22, followed by Indian women with the incidence of 1 in 24, and lastly, Malay women with the incidence of 1 in 35 for this study itself. And if you look at the age-specific incidence rate, you can see that there is a peak age-specific incidence rate in the 50 to 59 age groups, with the highest incidence happening in the 55 to 59 age groups, which goes to show how much we have to take care of ourselves the older we get. So this table is taken from the Malaysian Clinical Practice Guidelines. So as you can see, the risk increases significantly as a woman ages, with a steady increase starting from 30 years old, if you look at the table. So very simply, if you just look at the table, I know it looks a bit complicated, but if you just look across all races, it goes from a single digit to double digits. And once we hit age 50 and onwards, it increases to a triple digit per 100,000 population. And so why do you think this is so important? Well, it is because each year, more than 500,000 women in the world die from breast cancer. And this is more than the population of Brunei, which has a population of 433,000. So as we can see, awareness and detection can be life-saving once we know what to do. So this is the current recommendation given by our Malaysian clinical practice guidelines. It recommends for mammography to be performed biannually, which is every 2 years, in women aged 50 to 74 years old. And if you happen to fall under the high risk for breast cancer, it should be done from age 30 onwards. And contrastingly, screening is not routinely offered to average risk women aged 40 to 49. But if they wish to do so, it will not be denied by your healthcare provider. So I've mentioned a lot of things about risk. So what exactly is considered as high risk? High risk refers to people who have a significant family history, meaning first degree family who has breast cancer. So first degree means either your mother, your child, or your sibling. So, and also if they happen to have a carrier of the BRCA1 or BRCA2 gene mutation, that also puts you at a higher risk. And if you have been diagnosed with a benign breast disease and they have looked under the microscope and they found that it was atypical hyperplasia, then you will also be classed as high risk. And if you had history of an invasive breast cancer before, that also puts you as a high risk. So screening at 30 years old from onwards would be best in order to prevent the progression of breast cancer. So as a summary of this very wordy slide, women who fall under high risk for breast cancer, it would be best to start consulting your doctor for a mammogram if you are 30 and above. And if you are 50 to 74 years old, mammography should be performed every 2 years. Okay. So that's breast cancer. I'll next move on to talk about cervical cancer. So first of all, just to give you a little talk about what actually is cervical cancer. It is cancer of the cervix. The cervix is found at the lower portion of the uterus. From this image, you will be able to see the uterus is the upper portion, and the bottom portion below here is the vagina. So the cervix is the one that connects the uterus, to the uterus and the vagina. It's much like a gateway between the two. So cervical cancer occurs when cells in the cervix go through changes and abnormal cells begin to appear and turn into cancerous cells. And almost all cervical cancer cases, 99% of them, are linked to an infection with human papilloma virus, which in short, we call HPV. And this happens to be an extremely common virus transmitted through sexual contact. So let's talk about the positives. So cervical cancer is detectable, preventable, and treatable if caught early. This is why awareness about this disease is vital. It is the second most common cancer among women in Malaysia. But the biggest problem is that it is hidden or silent because patients tend to have no symptoms. So you may ask, in what way is it detectable then if you don't have any symptoms? Well, we have screening tests available for cervical cancer. And how is it preventable? There are vaccines available. And in what way is it treatable? It is treatable in that when it is caught early, there is an 80% chance of beating the cancer. So in order to prevent cervical cancer, we need to know what the risk factors for cervical cancer are. So these are some of the risk factors. If you have more than 3 sexual partners, early sexual intercourse below the age of 17 years old, first delivery before age of 17, high parity, which means having more than or equals to 3 children, or having more than 10 years use of oral contraceptive pill, or if the patient has been smoking. So the next common question is, what do patients usually present with? The thing with cervical cancer, it is, like I said, it is sometimes silent. So most women are asymptomatic, meaning they present with no symptoms. But when they do present with symptoms, they come in with postmenopausal bleeding, vaginal discharge, postcoital bleeding. Postcoital means bleeding after sex. Some may come in with vague symptoms like abdominal pain. So now again, to show you the impact of cervical cancer on our world population, each year, more than 600,000 are diagnosed with cervical cancer, and more than 340,000 deaths were caused by cervical cancer in 2020. That is a large number of women for a very preventable disease. So that brings us to the question then, what can we do to reduce our risk? For one, get vaccinated with a HPV vaccine. So generally, the recommendations for a HPV vaccine is at the age of 9 years old, we can start administering HPV vaccines, but it is normally recommended for preteens aged 11 to 12 years old. In a broad sense, that just means to get vaccinated before being sexually active. And it is recommended in all patients below 26 years of age. And at 26 and above, it involves a shared clinical decision, meaning you need to discuss with your healthcare provider if it is indeed indicated. This is because at age 26 and above, there exists an already higher chance of already being exposed to most risk factors. And it has shown that vaccinations provide less benefit 26 years and above. So other ways to reduce your risk would be to go for screening tests. I will explain more on what kind of screening tests are available now. And thirdly is to stop smoking. And because HPV is mainly transmitted through sex, it is important to use condoms during sexual intercourse and also limit the number of sexual partners. So in terms of screening tests, we have 2 screening tests available. So screening tests means tests which are able to detect cervical cancer. So the 2 screening tests available are the Pap Smear and a HPV test. So the Pap Smear looks for precancerous cells as opposed to the HPV test, which actually looks for the virus itself, which causes cervical cancer. So just to have just to show you the difference between Pap smear and HPV, this diagram is able to elaborate further on that. So what happens in a Pap smear is that once the sample is taken, it is placed under a microscope in the lab and it looks for abnormal cells. And it is a test that has been around for the past 80 years and is routinely done in all our clinics for free. So you can basically just walk into any clinic because they have done and they'll be able to help you do it for free. Contrastingly, the HPV test is not really offered in the government setting, but it can be done if the patient is willing to pay for it. So the HPV test looks for viruses that can cause cells to change into cancerous cells, and it uses a modern technology to detect DNA of a high-risk HPV. So this begs the question then of when do we do a Pap smear? So generally at 21 years old, women should start getting Pap smears. And if it happened to be normal, then they can wait 3 years until the next Pap smear test. And between age 30 to 65 years old, a Pap smear and a HPV test should ideally be done every 5 years. And women more than 65 years old may not need to be screened anymore if they happen to have had normal results for many years. So this slide is to prepare you for your Pap smear or your HPV test. So basically you should not schedule a test when you're having a period. You should not rinse the vagina with water or another type of fluid. You should not use a tampon, and you should not have sex. And you also should not use a birth control foam, cream, or jelly. And you should also not use medicines or creams in your vagina prior to your Pap smear or HPV test. So all in all, it is important to mark your calendars and go for these screening tests. Remember, your health is important. So the next topic I'll be talking about is heart disease. So did you know that cardiovascular disease is the number one killer of women, causing 1 in 3 deaths each year? That is approximately 1 woman every minute. The truth is, women are less likely to call 911 when experiencing symptoms of a heart attack themselves. And the reason is because it does not occur to them to do so. You ask why? Well, because the bulk of media attention on the disease is focused on men. So this is an image taken from the Go Red for Women, which is a platform aimed to increase women's heart health, which very aptly demonstrates how some symptoms of a heart attack may go unnoticed by women. So you can see from this diagram here that the common symptoms for both men and women is chest pain, but women may experience less obvious warning signs. For example, they may not always have chest pain. And instead of having a squeezing chest pressure like in men, they might experience pain or pressure in the lower chest or upper abdomen. And they may even have fainting, indigestion, or even extreme fatigue, which is quite a rare symptom to have in someone who's having a heart attack. So, what causes heart disease? In order to understand the causes a little better, I will just briefly talk about the heart and what it does. So, your heart does a lot of work to keep the body going. Each day, the average human heart beats about 100,000 times, pumping about 7,000 liters of blood through the body. Imagine the amount of work for an organ no bigger than a large fist. So it pushes blood through a network of arteries and veins, a system we call a cardiovascular system. So it pushes the blood to organs, tissues, and cells, delivering oxygen to our cells, and at the same time also removing carbon dioxide and other waste products. So that is a lot of work for a relatively small organ. So when there is a problem with the heart, be it a heart valve problem, abnormal rhythm of the heart, or inefficient blood pumping, or perhaps blood vessel problems, it leads to heart disease. But the commonest cause of heart disease is atherosclerosis. So this is actually a buildup of fatty plaques in your arteries. So there are, as you know, as I've mentioned just now, there are many causes of heart disease, but the commonest, most important, and preventable cause is atherosclerosis. So just to give you a brief, um, just to give you a brief outline of what atherosclerosis is, it is a disease in which plaque builds up in your arteries, as you can see from this diagram here. So plaque is actually made up of fat, cholesterol, and calcium. So over time, when you have plaques within your arteries, it hardens and it narrows your arteries. And in very serious cases, when the arteries are severely narrowed due to the plaque buildup, blood flow is affected. So there may be partial or a total occlusion of the artery, which then limits the flow of oxygen-rich blood to your organs and other parts of the body. So sometimes these plaques, they get so large that pieces of the plaque breaks away. And when that happens, the body responds by producing a blood clot, which can further block your artery walls. So for example, if blood flow to your heart muscle is blocked, you may have angina. Angina is chest pain or chest discomfort. So as you can see, atherosclerosis can lead to serious problems like heart attack, stroke, or even death. So you may ask, then how do these plaques form? Actually, so cholesterol is a natural fat-like substance which is essential to have. However, when we have too much cholesterol in the blood, it can be harmful. So cholesterol is produced in the liver, but it can also be found in certain foods such as those high in saturated fats. There are many types of cholesterol, but the main type involved in atherosclerosis is LDL, which is your bad cholesterol. and HDL is as opposed to the good cholesterol, which is called HDL. So the exact cause is not known, but risk factors such as smoking, high blood pressure, diabetes, and high cholesterol have been known to damage the smooth lining of our arteries, which contributes to atherosclerosis. So once this layer is damaged, the bad cholesterol gets into the wall of the artery, which is why in order to prevent heart disease, we need to make sure that we remove all these risk factors. And in order to do that, we need to make a few lifestyle changes, such as not smoking, managing your blood sugar, so meaning getting your fasting blood glucose checked, and also your HbA1c, which is a type of blood sugar test which measures your blood sugar within for the past 3 months. And it's also important to get your blood pressure checked because it's also one of the risk factors for getting atherosclerosis, which then leads to heart attack. And also to lower your cholesterol by eating healthy, not eating foods with high cholesterol and high saturated fats. So, and it's also important to stay active and, of course, to lose and manage your weight accordingly and to also eat healthy. So, we have come to the end of the webinar. So, just as a little recap about what we have talked about, we covered breast cancer, and the important takeaway message for breast cancer is to get a mammogram arranged if you have high risk for breast cancer and if you are 30 and above. Also, if you're between 50 to 74, you must do a mammogram every 2 years. And in terms of cervical cancer, think about detectable, preventable, treatable. So we can detect through Pap smears, we can prevent through vaccines, and we can treat it once we catch the disease early. As for heart disease, risk factors such as diabetes, smoking, high blood pressure, high cholesterol, they all play a huge role in the development of a heart disease, which is why we need to reduce our chances of getting diabetes, hypertension, and high cholesterol. And this is done purely by adjusting our lifestyle habits. So these are just some references which I've for the webinar I've given. So I hope you enjoyed this webinar. Thank you for listening. Thank you.